Late Night Health continues. Our guest is the CEO of Wellthie. That's Wellthie. Her name is Sally-poblete. I don't hear so well, guys. It's really bad. Sally, welcome to Late Night Health.
Thank you so much, Mark.
My first question to you is pretty simple. You're a digital healthcare company. You help consumers understand health insurance. So in general, and I just told you a personal story about me and the wonderful people at Anthem Blue Cross, are health insurance companies actually selling what the consumer thinks they're buying?
You know, that's a really great question, Mark, and a pretty common question. And I think that all in all, the insurance product is quite a complicated product. So there's really a lot of need for education on the consumer's part, and certainly, a role that insurance companies are working hard to do a better job in. But and that is that of education, to make sure that consumers are clear about the plans that are available for them to purchase, who is eligible to buy those plans, the differences between the plans, the actual benefits that are covered in the plans, how much they will be paying, and so forth. So, part of the reason that we as a company, exist today is that opportunity for everyone in the industry to really create more transparency and clarity and education to help consumers understand the value of insurance, and then the benefits that they get, and then at the same time what it is that they're responsible for paying.
You've been involved in the health insurance business for how long now?
Well, overall in healthcare, probably about 20 years, and then specifically in health insurance, about 10. 8 of those years at a large health plan, and then another couple of years at a smaller health insurance company.
Do you find that, in your experience, that the agreements that health I know I'm putting you on the spot. I get it. We're gonna talk about some things that you want to talk about, but because you are working with consumers, I think you know the answers to these, and the policies and the coverages are so vague to me. It's hard to understand. Isn't that where Wellthie comes in helping to make the insurance agreement more understandable? Thank you, Hans.
Yeah, so it isn't specifically, it's sort of a broad goal about helping consumers understand the opportunity for them by insurance, the eligibility that they have to either purchase or qualify for financial assistance from the government, and then when they're picking from between several different health plans, the best health plan to choose that's appropriate for them. So, as I mentioned before, there's so much that's covered in the plan, and there's also exclusions and limitations in those things that are covered that make it quite complex. And we are working with insurance companies to help illuminate and make those items more transparent, as well as the Affordable Care Act, the law that has been passed that requires insurance companies to be consistent and much more clear about those coverages. And
have they been? Are they living up to the letter of the law?
Yes, absolutely. So just to give some examples, one of the items that's included in the Affordable Care Act is that all health plans must cover 10 essential benefits. And those include things like coverage for preventive care, coverage for mental health, emergency room visits, hospitals, maternity, and so on and so forth. So because there is a pretty clear set of standards about what needs to be covered at a base minimum for all plans, that it makes for, consumers can feel a lot more confident that these key categories in our healthcare are part of the coverage, as opposed to, wondering whether they are or aren't.
And Wellthie has been designed to make it easier for consumers to traverse the pages and pages of legalese, if you will, often associated to healthcare plans?
Yeah, it's not specifically, Mark, focused on the legalese. It's overall on, what plan should you purchase. So, the plan itself. So what does the plan incorporate and how much does the plan cost for me and my family in a particular geographic area? And would I qualify for financial assistance like Medicaid or tax credits to buy an individual plan or any of the subsidies offered by the government? Those are the kinds of very important and common things that consumers are asking today that they need help navigating. Our
anti-aging specialist, Dr. Hans Kugler, is waiting to ask you questions. So I'm going to let him ask you.
Okay. Now, what your obviously was people are buying includes some of the drug coverages, right? That's an established fact. But there's apparently a lot of politics going on behind it because some people that did not like any of the Affordable Care Acts or wanted to make it more difficult, this is the pharmaceutical industry. Right? I mean, I myself work at a health center and we buy from a medical supply house. So this one friend of mine, an MD, suggested that I use a very simple whatever drug, right? And that I used to buy wholesale as a doctor's price, a 3-month supply for $8.50. Now, when this doctor reminded me, say, Hans, you should be taking that stuff. It's no harm. It's good stuff. It's a natural compound. I said, okay, fine. So I called the medical supply house, and guess what? The $8.50 have now increased to $183.
Assuming now that you're not taking that,
right?
And Sally, I know that you didn't write that. Why does that happen? Why has that happened?
Yeah, well, Dr. Hans, I'm sort of needing a little bit more specifics on kind of your situation, and I'm not an expert in pharmaceutical costs.
Right, yeah, but it's not exactly my specific case, right? I then asked around a little bit. For example, I shop at Costco, and there's one of the pharmacists down there because my dad used to be a pharmacist, so we connect. And I asked him about this. He says, yeah, we are extremely embarrassed because almost every drug company did raise the costs at a level that is just literally sometimes not only hundreds, thousands of %. I mean, they are sucking us dry with money. And,
Hans obviously has his point of view, and it may not be appropriate for you to answer, and I get that, Sally, but has the Affordable Health Care Act, in your opinion, has it been successful in, one, providing more people with health coverage? And are you getting a lot of questions about pharmaceutical care, hospital stays, as people are looking to purchase insurance policies?
Have they done anything about the problem?
So the Affordable Care Act has certainly increased the number of people who have been covered. Just last year, there were about 10 million people that purchased insurance, individual insurance, as a result of the Affordable Care Act, and many millions more who are covered by Medicaid. I think the pharmaceutical question is a common one, as well as sort of being covered in the hospital. And I think the key thing for consumers to take away is when you pick a plan, you must, and if you are taking a set of drugs, look at a document called a formulary. And that is the list of drugs that are covered by that plan at the lowest cost. So generics are typically at the lowest cost, and then there are brand name drugs that are covered at the lowest cost. If your brand of drug that you're taking is not on the list, then that is worth a phone call to your physician and or the insurance company to see if there are alternatives to the drug that you're taking that will likely be less expensive than the drug that you are.
All right. As a healthcare consumer yourself, Sally, do you like the idea of formularies?
I think it is necessary. because it is necessary for us to have kind of a checks and balance on the cost of pharmaceuticals. And if any drug must be covered, then at that point the manufacturers of drugs can pretty much identify whatever price they want to charge for that. So it is a good checks and balance system that I think is helpful. And it is key to note for consumers that every insurance company has a different list. I know that adds a bit to the complexity of navigating the system, but United Healthcare will have a different list of drugs that they cover versus Anthem versus, Cigna, et cetera, et cetera. So it is, as I said, key to look at that list. It is widely published within the website of every health plan, or if you're shopping on healthcare.gov.
Our guest is the CEO of Wellthie, sally-poblete. Okay, I got it now. Sally-poblete. And we're talking about insurance from a consumer standpoint, and that's what Wellthie helps you to do, is to traverse and make up your mind on what health plan is best for you and your family. I want to talk briefly about open enrollment. Shouldn't somebody be able to enroll in healthcare at any time they want? Or
that is another great question, Mark. So open enrollment exists to really put a more organized system to the time that you're buying insurance, so that everyone knows this is the time for you to buy insurance. And it's a window of time, once a year, and when anyone who does not currently have coverage can buy on their own. The reason why you cannot buy insurance at any point of time in the year is frankly because, we need to have a system in place where, right, insurance is you pay every month, and then when you need the care, that is when you access the coverage. If you were to buy only at the time when you need the care, then we're not. It's not insurance. It's effectively, getting coverage only at the time you need it, and that really, in terms of general insurance principles, doesn't work. It's like, getting homeowners insurance only when you expect that you're going to get robbed, or only when you expect that a flood is going to happen, or some damage
or
to your house
car. You have a car accident or something.
Exactly.
Like that.
I'm only going to get insurance now for my car because I expect to recklessly drive and I expect to have an accident. Right? It doesn't really work that way. The system works best and most cost effectively for everyone when we buy insurance throughout the year, and God forbid something were to happen to us, that insurance is there to protect.
When we come back, we'll have a couple more minutes with Sally. She's the CEO of Wellthie, and the company is there to help you as a consumer make better choices in what you get. Would you agree with that, Sally?
Mm-hmm.
All right. So we're going to take some time out. Dr. Hans is here. The insane Daryl Wayne is here. And Kevin Stern is here. We'll be back with more of Late Night Health. Join us at latenighthealth.com. latenighthealth.com.
Late Night Health with your host, Mark Alyn, will continue in a moment.
Tired of paying outrageous prices for Viagra? Well, we have great news for you. Now you can finally get Viagra at huge discounts. Healthy Man allows you to save up to $500 on Viagra. Why pay U.S. pharmacy prices of $15 per pill or more when you can get Viagra for less than $3 a pill? Call today and get 40 Viagra pills for only $99. This can cost as much as $600 at your local pharmacy. You can't afford not to call us. If you want Viagra at the lowest prices, never pay $15 $15 a pill pharmacy prices again. Get Viagra for less than $3 a pill. Call 800-789-7213 today and save up to $500 and get 40 pills for just $99. Healthy Man is fast, easy, and affordable. Operators are waiting at 800-789-7213 to take your call now. Call 800-789-7213. That's 800-789-7213. Again, 800-789-7213.
Have you ever needed a flashlight and reached into a drawer to find your flashlight is dead, and then go to put in new batteries only to find the insides are all corroded? Now Hybrid Light has created a solar-powered flashlight that requires no batteries and also charges your cell phone. Hybrid lights are durable, waterproof, and hold a charge in the dark for up to 7 years, and perfect for any emergency or everyday use. Now you can get your own Hybrid Light today for only $34.95, and if you mention health, you'll receive a Hybrid Light headlamp absolutely free. That's our durable Hybrid Light with a free headlamp for only $34.95, a value of $60, only $34.95. Call us today at 800-297-8109. That's 800-297-8109 to get this special Hybrid Light offer today. 800-297-8109, 800-297-8109. In the promo code box, type in HELP. 800-297-8109.